Welcome back to News 3 Today at 11. Today we are focused on women's health and the importance of getting annual checkups and routine screenings, especially if you are a woman of a certain age. St. Joseph's Candler OBGYN Dr. Montes joins us now with more. Thank you so much for being here.
It's my pleasure.
So I'm asking for myself
Absolutely.
and the women my age, because sometimes we think that these screenings and checkups aren't important when we reach a certain age as women. Not so.
Not so. It's very important to go to your OBGYN for a regular checkup. And because throughout the lifespan, there's going to be multiple things we're checking for. You know, someone who's in their 20s, we're going to be talking about fertility, 20s, 30s, 40s. Then when you make that transition to menopause, there's going to be other healthcare aspects and concerns that we're trained to take care of. And so we're here as OBGYNs to take care of women through the entirety of their lifespan.
Yeah, and so not going to these routine checkups and getting these screenings could actually put our lives at risk.
Absolutely, yes. And you know, from everything from a routine breast exam, routine pap smear, and a lot of times in our annual visits, just talking about what's going on in a patient's life, they will mention things. We're like, oh, okay, let's talk about this. You know, also on top of that, family history with family cancer history. We have so much new technology now, and a patient tells us, yeah, my mom had breast cancer in her 40s, or I had a grandmother with ovarian cancer. We have technology now to do blood tests to look and see if women are at risk to have the genes like BRCA gene, Lynch syndrome, things like that, that will help guide us in how we're going to treat women to make sure we prevent these cancers from happening.
You mentioned technology. You were recently, you recently received your board certification in minimally invasive gynecological surgery, one of only 2 in the region.
Yes, me and Dr. Schlafstein at St. Joseph Candler, we're one of the 2 that have this certification. It's a new certification in the world of OBGYN because OBGYNs were surgeons, but we're also obstetricians, and we also do a lot of primary care. But with the minimally invasive GYN surgery recognition, it means that I'm a high volume gynecological surgeon. And what studies do show is when you are a high volume surgeon, you have better outcomes. And so that was amazing to be recognized as this. I had to get so many cases, take an exam, and got the board certification. And
you work with the Da Vinci robotic surgical system.
I do.
And you actually prefer this.
I do. I love robotic surgery because one, it's decreased pain. Also on top of that, the actual visualization is incredible. I sit at a console and I look into a camera that's 3D. And so traditional laparoscopy, you're looking at just a TV screen. And that's 2D, but here I actually have 3D and I control 4 arms. And so I actually have then a camera arm and 3 arms myself to operate. And I do it through a very small 8mm incisions, and surgeries that patients would have to go home after 2 or 3 hospital days can go home same day now.
So this is more precise, would you say?
It is, it is.
Okay, so we want to talk about 2 things before I get to your personal life and all up in your business. Endometriosis and fibroids.
Absolutely. I would say those are one of the 2 main conditions as a minimally invasive GYN surgeon that I take care of and treat. I get it all too common. Patients come to me and say, I have been told my whole life that it is normal to be in pain, especially around a certain time of the month. That's not the case. There are many conditions such as endometriosis, fibroids, that are the cause of a patient's pain that can be treated. And when we look at endometriosis, it's a condition in which the cells that line the inside of the uterus that grow during a normal cycle somehow find their way into the pelvis and the abdomen. And honestly, it can wreak havoc and cause a lot of scar tissue. Infertility, about 25 to 50% of infertility can be caused by endometriosis. And then on top of that, fibroids are actually benign tumors of the uterus that can grow quite large. I've taken uteruses out that are large because of fibroids, and it causes pelvic pressure, heavy bleeding, and pain. And so the big takeaway is patients need to realize they're not supposed to be in this kind of pain, and that we have the resources to treat it, from medical management to surgical management.
Okay, so we have about 30 seconds left. I do want to mention that you are from Savannah, born and raised. You went to Georgia Southern University. You also have a clinic called the Hearts and Hands Clinic that provides free health care for medically uninsured individuals from Bullock County.
Yes, so that's a project I did when I was in college, and what was amazing is after about to start medical school, I handed it off to another team member there, and it's just amazing to see that it's still there, that it's providing care, and it's really changed a lot of lives, and it's a true community clinic. And to sit back from afar and look back and see how far it's come is incredible.
Dr. Montes, thank you so much for joining us today.
Absolutely.
We appreciate it.
Thank
and
you.
you can find this interview and more information on our website at any time by visiting wsav.com/community corner. Now it's time for a look at our forecast. Good morning, Hannah.